These are the real stories of the ER that doctors never talk about.
Why aren't you guys helping her?
Helping who?
My mother.
She's stuck on the toilet.
She's what?
Husband left the seat up.
She's been wedged in pretty tight for over 18 hours now. Do we have anything that could break the toilet?
If you can imagine an emergency room with power tools arriving in it.
We're inbound with a 35-year-old male. Got himself caught in a stump grinder.
Stump grinder?
I told him to get a professional to do the trees, but he's just so damn stubborn.
He starts screaming in pain.
Does that hurt?
Flesh and bone and muscles and nerves. But at this point, we know we have some major problems.
Wiggle the toes in the right leg.
I'm trying.
Am I paralyzed?
We have a nurse who collapsed upstairs.
Stan, you can't keep me here. Stan, take it easy. I need you to lay back. We can see for ourselves that you're sick.
Take this thing out! Rip it out now! Now!
These are the untold stories of the ER. As a paramedic field chief, John Genova is a man a lot of people count on.
I'm in charge of a group of ambulances. I go and visit them, take runs in with them. I interact with the firemen in my district, too.
John, come in, John.
Go for John.
Hey, John, we got a situation here. 19 Bakerview. Fire unit's on its way, but we could use a little more support.
What kind of situation? Well, they didn't say too much over the radio other than, can you take in this run? Knowing my crews, that's not a usual statement that I had heard, so I knew that was something different here. When I walked in, I was met by the crew. So, what's the emergency?
Why aren't you guys helping her?
Helping who?
My mother.
John, we've got a female in her 50s with a porcelain problem.
She's stuck on the toilet.
Well, they explained to me what was going on, and the words, you know, I heard sounded a certain way that was kind of unique, but the visual was so much more unique.
John, this is Nancy, 51. Her blood pressure is 100/70, and pulse is 120. We tried pulling her out, but she's stuck.
There's a handful of these things when you walk in and you say, how did this happen? It was one of those jaw-dropping visuals that you look at and, you know, you take that breath and then you got to go to work. Nancy, my name's John. I'm the paramedic field chief.
Can you get out?
How long have you been stuck?
Since 2 o'clock in the morning.
About 17 hours, Chief.
Nancy, we're going to take care of you. We just have to figure this out. Give me a minute. There's an initial aggressive discussion that takes place between everybody coming in right away.
I don't know, why don't we feed a hose into the toilet tank?
You got to be kidding.
Water pressure from below.
Got any grease?
Why would we have grease? What do you guys have on the rig that's slippery?
I can't think of any.
For God's sake.
Oh, petroleum jelly. Okay. Maybe grease this thing, try to get her out. Pardon me, ma'am.
Oh no.
See if we can make that work.
No.
Okay, down, down.
Please.
So what now?
Dr. Valenti. Hey, Stan. Everyone, I'd like to introduce you to Dr. Valenti.
ER physician Matthew Valenti is well known to the staff at his hospital.
He was the first ER doctor I worked with when I started here 4 years ago.
You're starting to make me feel old.
If you're lucky, you'll get to work for a doc like him. Any advice for our up-and-coming nurses?
Prioritize and pace yourself. On Stan's first day, we had to treat him for exhaustion.
You made that up. Carry on.
You're kidding.
No, I'm not kidding. The doc just looks up at everybody around the bed and says, give me the thoracotomy tray.
He's gonna crack the guy's chest open right there.
Right there. I mean, it's the only chance the patient has. He's never gonna make it to the OR alive.
Yikes, that is intense.
When was this?
Last night on trauma, life in the ER.
You know, there's people doing all sorts of things in the emergency department to, you know, alleviate the stress and cope with all the emotion that's always going on. Don't you guys get enough of this stuff at work? You guys are a bunch of ER junkies, if you ask me.
Dr. Valenti, we have a nurse who collapsed upstairs. We're gonna bring him down in a wheelchair.
Who is it?
Stan Williams, he was in the middle of teaching a class and he almost passed out.
Stan. Stan, how you feeling, buddy?
Lightheaded.
Any shortness of breath?
Yeah.
Do you have any medical problems I should know about?
Have myasthenia gravis.
Myasthenia gravis.
Myasthenia gravis is a disease where it causes weakness of the muscles, and under stress or illness, it can cause a patient to stop breathing.
He's starting to lose consciousness. Let's get him in a room.
He was very sleepy.
Stan, how are you doing?
Face.
Yeah.
Stan. He's pretty somnolent.
What do you think is wrong with him?
He said he's got myasthenia gravis.
He was also recently diagnosed with pulmonary embolism. That's why he was off work for a few days.
Let's start with some basic blood work. Let's get a stat EKG and chest x-ray. A pulmonary embolism is a blood clot to the lungs, and usually they start off as blood clots in the legs.
Good. I'll call you right back.
Is he on any blood thinners for his embolism?
He's on Coumadin, I think.
Patients are routinely treated with a medicine called Coumadin, which thins out the blood. It doesn't actually dissolve the blood clot because those medicines are very risky. So actually what it does is it prevents the blood clot from getting bigger while the body's able to resorb the blood clot.
Dr. Valenti, we need help.
Stan. Stan. It's all right. It's all right. Looks like you ripped out his IV. He's out cold.
For ER physician Randy Jotty, medicine is just one part of the job.
So Stan, I just got off the phone with the oncologist, and they're going to see you right away.
People wind up in the ER at critical moments in their life.
It's a great opportunity to perhaps help them out. So it's a privilege. Emergency medicine is where that happens. Our hospital's in an urban location.
Hospital, this is Medic 5.
We have a very active helicopter.
Go ahead, Medic 5.
So we get people that are sent in from far away from farming injuries, from motor vehicle accidents that are hours away.
We're inbound with a 35-year-old male. Severe avulsion fracture to the left leg. Got himself caught in a stump grinder. ETA 12 minutes.
Stump grinder. So I cannot imagine what that would do to flesh and bone and muscles and nerves. Let's prep the trauma bay. We've had lacerations, gunshot wounds, things like that. Stump grinder is very impressive.
Dr. Jotty, the man's wife is waiting. Can you talk to her?
Yes, I'll be right there.
Okay.
Hello, I'm Dr. Jotty.
What's happened to my husband? They said they're bringing him in a helicopter?
We don't know much. He's not here yet. We heard he got his leg caught in some machinery.
Is it serious?
It could be. Apparently, they had originally been living in the city, and there was a decision that was probably, she said it was his decision primarily. We want to move out to the country.
I told him to get a professional to do the trees, but he's just so damn stubborn. Danny, what happened?
Got my leg cut. So stupid.
This is Daniel, age 35, left leg laceration, completely degloved. He's in a regular sinus rhythm. BP's holding at 110/70. He's on O2 at 6 liters.
Daniel, I'm Dr. Jotty. We're going to take good care of you. Are you in any pain?
I'm okay. They gave me some morphine.
Gave him 15 milligrams.
Great. He's still in his work clothes. He's got a shirt on that's been torn a little bit, but there's dirt on it. He's got sawdust and chips in his hair. Daniel, I need to take a look at your leg. We got to get these dressings off, and you let me know if this hurts. Just relax, okay?
Okay.
And he's quite calm. His airway is fine. He's breathing comfortably, and he's actually very alert as to everything going on. His leg is mangled. It's in bad shape. I didn't think this guy's leg was salvageable.
Break the toilet.
I'm thinking that's what we might have to do. You can see this lady was in distress, and we don't want to fracture anything.
Hey, Chief. We've got an axe.
Daniel, I need to take a look at your leg. Just relax, okay?
Okay.
Dr. Randy Jotty's patient has had his leg mangled by a stump grinder.
It's a devastating injury. Let's start a second large bore IV. Get a CBC Chem 7 tap and cross him for 2 units packed cells. Let's give him a gram of Ancef and a tetanus shot. Get radiology down here, stat, to do x-ray plain films of this leg. Let's get orthopedic surgery and vascular surgery down here, stat. The bone is pretty much just chipped up, going really from the knee down to the ankle. The soft tissues, the inside of the leg was still intact, which was the only thing that kept the leg as a leg.
Good to see you. His vitals are holding up, no pulse in this injured leg, though. Daniel, can you tell us what happened?
I don't know. I have a picture of the Stump Grinder. That's the machine. That's it there.
Danny, why are you showing him pictures of the Stump Grinder?
It actually can be useful.
Daniel, how did this happen?
I don't know. I was grinding a stump in the yard, and next thing I remember, I was in the helicopter.
He doesn't really know how the injury occurred.
Doctor, am I gonna lose the leg?
Daniel, I don't know. We're doing everything we can to save it.
The big issue was the blood flow. If he's not getting any blood flow to that foot since the injury occurred, it's gone.
Let's reposition the leg.
Daniel, we're gonna move your leg. Let us know if this hurts and we'll give you some medicine.
Okay.
We repositioned it. We try to get it in its normal anatomic position. The thing that's remarkable is it should be excruciatingly painful. He should be screaming in pain, and that's just not happening. I mean, it could be an Army Ranger or Navy SEAL, but nevertheless, it's not what you expect.
Take a deep breath, Daniel.
The surgeons are moving that leg around, and it's not even grabbing his attention.
Again?
You know, in emergency medicine, you work in patterns. His pattern was not correct.
Daniel, squeeze my fingers. Good. Daniel, can you wiggle the toes in that left leg? Okay. Daniel, wiggle the toes in your right leg. Daniel, wiggle the toes in your right leg.
I'm trying.
Suddenly, the alarm bells go off. There's much more going on here.
Daniel, can you feel this?
No.
And I take a pen, and I squeeze his toe between the pen and my fingers tightly.
Daniel, can you feel this?
No.
What's the matter? Okay, what does this mean?
It's all right, Stan. It's all right.
The nurse Dr. Valenti is treating has suddenly passed out.
He's out cold. His breathing was worse, his blood pressure was dropping, and his heart rate was dropping. So I was worried he was gonna stop breathing.
Systolic 72, heart rate 48.
I can't find a vein.
I'll put in a central line. Give me a femoral line kit and let's recycle the blood pressure. I was concerned that he could be having a myasthenic crisis where his muscles are getting fatigued, or he was suffering from weakness from a recurrent pulmonary embolism. Chest x-ray is clear.
How is he, Dr. Valenti?
His blood pressure's dropping.
Can I speak with you outside?
Sure.
I was just wondering, over the last few weeks, Stan has been sleepy and lightheaded.
Do you know if he's on any other medications?
I just called his wife, Susan. When she gets here, I think it's best that you speak with her.
Eileen, you know, if he's on other medications, I need to know about it.
I think you should check him for narcotics.
Why do you say that?
Just check him.
Paramedic Field Chief John Genova and his team are unable to extract a woman who's stuck inside a toilet bowl.
If you don't mind me asking this, ma'am, how did this happen?
Middle night. Sit up.
My father left it up. He went up north last night to go fishing. We've been trying to reach him, but he's off the grid.
Break the toilet. I don't care.
Well, ma'am, I'm thinking that's what we might have to do.
Break it with what?
Hey, Chief. We've got an axe.
Hang on.
You could see this lady was in distress, and we don't want to fracture anything. Our biggest concerns were, you know, if this thing breaks, jagged edges on a porcelain toilet could, you know, really cause some significant damages to her.
Let me make a phone call. I'll be right back.
The emergency department of the local hospital is run by ER physician David Zoll.
Dr. Zoll?
Yeah.
Paramedic chief on the phone.
It's Dr. Zoll?
Doc, I've got a patient here, middle-aged woman. She's stuck in a toilet.
She's what?
They couldn't extract her, and they needed advice as far as whether to transport or whether to continue care on the scene.
Your call. We can do it. Do you have a wrench in the house?
Why?
Well, we're gonna have to take her to the hospital with the toilet.
Her bottom had swelled, and she had got wedged in so tightly that just pulling her out was not feasible.
What can we prep?
Well, no special prep. We just need to make a lot of room in the trauma bay. There's going to be a lot of commotion.
Okay.
Our heads were still spinning as far as where to go with this case, so we thought, well, let's not ring any alarms until we actually see her.
Okay, come on back. First step is coming up right now. Here you go. First step.
One step at a time, guys.
Okay, go slow, stay to the middle. There were people out looking, and it clearly was a very unusual sight, but we tried to give her privacy so that not a lot of people would, kind of stare at her. We creeped to the hospital, about as slow as an ambulance could move, because we didn't want to jar her too much.
One couldn't help but giggle a little bit because it was just such a crazy scene.
This is Nancy. She's been stuck in there for nearly 18 hours.
Hi, Nancy. My name's Dr. Zoll. Are you having much pain right now?
I can't feel my legs.
She looked dehydrated, but in terms of dry mucous membranes. Her eyes looked a little sunken.
Husband left the seat up.
Let's get her in trauma bay, too. My big concern when she arrived was the development of a blood clot in her legs. The big complication is when they embolize or travel or break loose and then go to the lung, which can be a life-threatening complication. Typically, blood clots are screened by ultrasound, but the patient was in a difficult position, literally. So the first priority is checking for pulses just to make sure there's a good arterial flow. Sandra, can we get a large bore IV? I'll give her a bolus of saline, and let's send a CBC, basic chemistry, and a total CK.
Okay.
Nancy, how are you feeling?
Like I want to pass out.
Daniel, I'm worried you could have a spinal cord injury. He should have had a cervical collar placed at the scene. I should have put one on him when he first arrived. We hadn't, it was my distraction with the leg injury.
Am I paralyzed?
Nancy, how are you feeling?
Like I want to pass out.
The bizarre predicament of Dr. Zoll's patient who's stuck in a toilet may also be life-threatening.
BP is 90/60.
When are you going to get me out, please?
As soon as we can, Nancy. The primary concerns were blood clots in the veins as their blood flow into the extremity. But other issues would be, is there a nerve injury? Also muscle crush injury with release of muscle enzymes and potential kidney damage from that release. I need to take a little closer look to see how closely wedged you are here, okay? Pardon me.
She's really in there, Doc.
Doc, when we were there, there was nothing we could do. She was really wedged in.
Yeah.
Yeah, unfortunately, Nancy, you are really tightly wedged there, quite swollen.
There was just physical swelling that prevented her from being lifted out.
Do we have anything that could break the toilet?
We first looked around in terms of in the ER, is there anything that we could use to actually break the toilet?
This.
Guys?
We got nothing, Doc.
Oh, boy.
There was nothing really strong enough that would even remotely break a toilet.
Dr. Zoll, the patient's daughter is here.
Mina? Good.
Nancy, I'm gonna go speak to her for a minute, okay? Hang in there. When the daughter arrived, first priority was to get more information on her medical history. Mina?
Hi.
Hi, I'm Dr. Zoll.
How's my mom?
She's doing okay. She's been through a lot, so she's a bit groggy right now. Can you give me any information on her medical history? She's not able to give me much detail at this time.
Okay, maybe.
She indicated she isn't on any medications right now.
That's right, except insulin.
She's a diabetic?
Yes.
Learning that she was diabetic was really a critical turn here. Any idea when she last had insulin?
She missed 2 before I got there, but I gave her an injection when I found her.
Paramedics aware of that?
No, I forgot with all the commotion.
That the patient was diabetic and indeed had gotten insulin with no calorie intake of any sort. We were concerned about hypoglycemia, a low blood sugar level. We were originally attributing her mental status to being dehydrated, fatigued, lack of sleep, and indeed a lot of it was probably related to the hypoglycemia.
Seriously, though, why didn't you put the seat down? Why don't they put the seat up when they're done peeing?
Sandra, can you get a finger stick glucose?
45.
Let's give an amp of D50, and we can recheck it in about 20 minutes.
When are you gonna get her out of there?
Soon. Hang in there, Nancy. Guys have any ideas? Any suggestions?
No, Doc, nothing's really changed. We don't have anything.
Sorry, Doc.
Dr. Valenti has just been told that his patient, a nurse at the hospital, may be abusing narcotics.
One of the telltale signs to see if a patient's overdosed on narcotics, particularly opioids, is to look at their pupils. Pupils are 4 millimeters and equally reactive, not pinpoint. And so this, to us, meant that the patient most likely was not experiencing a narcotic overdose. Gwen, call the lab, have him add on a tox screen.
Okay.
His breathing actually got slower, so I'm worried that this patient's gonna stop breathing.
Doc, this is Susan, Stan's wife.
Hi, Susan, we've met, come in.
Stan? Is he gonna be okay? Why is he unconscious?
We're doing what we can, but I really need some more history. Is he on any other medications besides what he's taking for myasthenia gravis?
No, not that I know of.
Are you sure?
Can he hear me?
No, probably not. Susan, this situation is really serious. We're gonna have to put him on life support before he stops breathing. The patient's muscles, because of the underlying myasthenia gravis, are not able to keep up with the patient, and they're not able to support the patient's breathing. It was very clear that something was on her mind.
I'm gonna tell you the truth.
Daniel, can you feel this?
No. Dr. Jody has just realized that his patient, who was mangled by a stump grinder, can't move his uninjured leg.
When we were doing all these things with his left leg that was so mangled, he wasn't crying out in pain. He wasn't feeling anything in either leg.
What's the matter? What does this mean?
Daniel, I'm worried you could have a spinal cord injury. Let's stabilize the C-spine right away. You get me a Philadelphia collar?
Fortunately, he hasn't moved his head or his neck. He's still on the backboard.
Am I paralyzed? Daniel, does this hurt?
No. He should have had a cervical collar placed at the scene. I should have put one on him when he first arrived. Fortunately, he hadn't moved his head, but we put a Philadelphia collar on at that point to stabilize his neck.
We're gonna need to check out your back. We're gonna need to give yourself a bear hug, or we're gonna log roll you. Okay, on Rosie's count.
We roll him over to his side.
1, 2, 3.
And he starts screaming in pain just as we do the roll.
I'm gonna feel along your back, along all your spine. I want you to tell me if any of this hurts. Yes or no? Does that hurt? No. Does that hurt? No. Does that hurt?
But then we start, percussing, palpate along his thoracic spine, his lumbar spine, and we get down to the lower thoracic spine, about T10.
Does that hurt? Okay, all right. Again, let's roll him back. Rosie, on your count.
On 3. 1, 2, 3.
Get him covered.
So at this point, we know we have some major problems.
What's happening?
Daniel, I'm worried you could have a spinal injury. We need to get a CT scan on you right away.
Below the 10th thoracic vertebrae, he has no feeling.
Am I paralyzed?
Oh, no.
I don't know. We need to get the CT scan to find out what's going on.
But if this guy is paralyzed from the umbilicus down, it doesn't really matter that much what that leg looks like. He has a much more serious injury going on.
Tanya, why don't you have a seat in the waiting room? I'll let you know as soon as I find anything out.
I can't believe this is happening.
I know. Do you want to speak with the social worker?
No.
Just don't lose hope, okay? We're doing everything we can.
I know. Oh, no, thank you, okay?
How's it look, Julie?
Short version, not good.
Transected spinal cord?
Well, no, he's got a chance in that department. He's got a burst fracture to the 10th
he just
thoracic
crushed
vertebrae.
that.
Yeah, this guy's in trouble.
So we contacted our hospital plumbing team.
Just do it.
3, 2, 1.
Am I paralyzed?
Oh, no.
I don't know.
For Dr. Johnny's stump grinder casualty, the news keeps getting worse.
He must have been thrown to the ground like a rag doll.
He's gonna be in the ICU a long time. Look at all that. He's got blood all on that side of the chest.
There's a pulmonary contusion there and the broken ribs.
He had a major injury to the chest wall and pulmonary contusion. which is major bruising with bleeding within the tissue of the lung. And that's a big deal because you're dependent on that lung tissue to exchange the oxygen and carbon dioxide.
We got to speak with spine surgery now. Daniel, we got a team of our best surgeons waiting for you upstairs. You're going to be in good hands.
Thank you.
I love you, Daniel.
I love you too.
It's not even about the paralysis anymore, is it?
The most critical injury was his lung injury, his pulmonary contusion. Basically, if you get so much blood in your lung tissue, you can't oxygenate the patient, and they die.
Never mind the leg. Is he even going to survive this?
You said the situation was serious?
Dr. Valenti needs information from his patient's wife.
Then I'm gonna tell you the truth.
The man's life may depend on it.
Stan has a problem with prescription drugs. It started a long time ago, and it's just getting worse and worse.
What's he using? This is really important.
I think he's addicted to fentanyl patches. Is it possible he OD'd?
Not all of his symptoms are consistent with an overdose, but it's certainly possible. I was in shock. This patient was a long-term employee with the hospital and was well-renowned, had a lot of respect by hospital staff. And so to find this out was disturbing for me. What were they prescribed for?
Back pain. We got in a car accident about 3 years ago on our honeymoon. Tourists should never try to drive in Mumbai. It was 3 years ago, but he never fully recovered. Oh my God. He's gonna lose his job over this.
I understand your concern, but we need to bring this out in the open and get him some help.
Oh,
Now I'm going back in there, but I'd like you to stay out here in case I need you.
Okay.
Can you two help me roll him on his side?
1, 2, 3.
Oh my goodness.
A fentanyl patch is a pain patch that a patient applies to their skin, and it delivers a very strong narcotic consistently to the body over the course of a couple days. And it's given to people for very severe pain. Let's roll him back over. The whole purpose is to be euphoric and be in a good mood, but ultimately one of the consequences is sleepiness, comatose state, and respiratory failure. Let's give him 2 milligrams of naloxone.
Really?
Yep, right now. And when we give that medication, if you give it to a patient who has had narcotics, within 30 seconds, the patients go from a state that's comatose into being wide awake.
Hold on, everybody.
Guys have any ideas?
No, Doc, nothing's really changed. We don't have anything.
Dr. Zoll has stabilized his diabetic patient, but after 18 hours, she's still stuck in the toilet, and he can't find a way to get her out.
Should we break the toilet and take our chances with lacerating her buttock and flank? But there's really no recourse here, so really breaking the toilet was the only good option.
No, I have an idea. Come on, hang in there, you guys. We'll get you out.
So we contacted our hospital maintenance and plumbing team to get their input and describe the situation.
That's right, in a toilet.
Of course, they were like, we'll come down. We have to see this first, before we decide what we're going to do.
Okay, thanks.
Blood work's back.
Oh, looks okay, other than the glucose, mild dehydration. It's great.
There were like 3 people that came down from maintenance, and I don't think they were prepared for what they saw.
That's a new one. Husband left the seat up.
Oh, Joe, thanks for coming. Time is of the essence. She's been wedged in pretty tight for over 18 hours now.
Apologies.
Just do it. Just do it.
What gear did you bring? Hey, I got one of those. Pretty sweet.
Well, they have chisels, they have some sledgehammers. Heck, a regular hammer, they could have used that too to try and do something with that, but you really needed something that was gonna make more of a precision cut if it's possible.
Whoa! Hey, easy, Tiger.
If you can imagine an emergency room with power tools arriving in it, you don't see that too often.
Now, Joe, she's wedged in really tight. We want to make sure there's no injury to her, the skin of her buttock or her pelvic area.
These are designed with pressure spots. But with porcelain, there's no guarantees. We'll do what we can.
I thought, well, they probably know best where a weak point would be, though I'm sure they had no experience either in terms of a situation like this. Nancy, we're going to put some lubricant between the skin and the edge of the bowl to give you some protection, and then wedge in some gauze as well.
Nancy.
Harold.
About time, Dad.
Are you okay?
Does she look okay? How many times do we have to tell you not to leave the seat up?
Mina, I'm so sorry. Are you sure this is the only way?
You know, I'm afraid so. I see no other option. Nancy, you're going to be okay. These men are professionals.
See, Big Bertha, Little Bertha.
They found a sledgehammer and brought it to the ER.
And Sandra and I will ensure your safety.
Should do it.
Guys, be ready to lift when he strikes. Each at an arm and spread the legs.
We kind of cradled her so that she wouldn't fall into the broken pieces, that we could hopefully break it and lift it away with minimal injury.
Everybody ready? 3, 2, 1.
Stan, you're really sick.
It must be this flu going around.
There's more to it than that. We've got a very upset patient.
Either take this thing out or rip it out now! Now!
Hold on, everybody.
Dr. Valenti has given his nurse patient a drug that will determine once and for all if he's been abusing prescription drugs.
It's all right. It's all right, Stan.
What in the hell?
It was clear that reversing that state so abruptly, there was no other cause.
What happened?
Stan, you're really sick.
My class. I must have passed out. It must be this flu going around.
There's more to it than that.
I just need a few days off and I'll be as good as new. Honey, you didn't need to come down. I'm fine.
No, Stan. You're not fine.
What did you do? What did you tell them? What did you tell them?
You guys leave us alone. Stan, I think there's a problem with your medications, and that's why you passed out.
Coumadin? You and I know both that's not a problem.
This was a narcotic overdose.
Are you kidding me? I'm not on any narcotics.
We can see for ourselves that you're sick. You were just unconscious on this gurney a minute ago. So at this point in time, we've got a very upset patient.
Look, you can't keep me here. I'm a nurse and I know if I was ODing.
Stan.
You either take this thing out or rip it out now! Now!
You're gonna be in good hands.
The mangled leg of Dr. Jotti's patient turns out to be the least of his problems. The man has even more serious spinal and internal injuries that he might not survive.
Is he even going to survive this?
Tanya, I won't lie to you. He's in really rough shape right now. But like I said before, don't give up hope. You still want to take a pass on the social worker?
Yeah. I'm going to focus on the hope thing.
Good. Me too.
In the operating room, they stabilize his spine with rods that and plates that bridge the 10th thoracic vertebrae that had been burst, and they had to amputate his leg. It was not salvageable.
See you again, Doctor.
Hey, Sarah, take care.
Yeah.
6 months later, Dr. Jotti can't help but wonder what happened with his patient.
I've seen 60 or 70,000 patients in my career, and this one stands out for obvious reasons.
Dr. Jody, there's somebody here to see you. Over there.
What a sight for sore eyes.
Nice to see you.
How are you doing? You look fantastic.
I got me a new leg, Dr. Jody.
Oh my goodness. How are you getting along? You must be in some rehab.
I'm just glad to be alive.
You look just great.
We moved back to the city.
Really?
It's my decision. And I decided that's where we actually belong.
Good for you.
Thank you for everything, Dr. Jody.
Thank you for saving my life. I needed to come and thank you personally.
You're both more than welcome. He was wanting to live in the country and give up everything else for it, and this was his one focus. In his case in the ER, we were just focusing on that leg injury, kind of losing track of everything else that could be going on. So it's really seeing the forest and not just focusing on those individual trees. It means a lot to me.
Okay.
Thank you.
Take care.
Best of luck to you guys.
Thank you, doctor.
Thank you.
Bye.
Bye.
You identify with the patient and how close they came to something that could have been very, very tragic. It was very fulfilling to be able to play a positive role in his life. He's lucky that he's alive.
Everybody ready?
Yep. Will breaking the toilet free Dr. Zoll's patient without injuring her?
It was kind of a unique situation. Everybody's standing by, waiting and hoping that you can kind of crack the egg away. You know, that's what we were trying to do there. Hardest egg we ever had to deal with, though.
3, 2, 1.
One good blow did it.
Okay, let's lift it up. Okay, straight out. Okay, good. Next one, come in, straight here. Straight in. Watch your, nice and easy. 1, 2, there you go. And down, beautiful. All right, hey.
Nice job, guys.
Are you okay, Nancy?
The worst is over, Nancy. How are you feeling? In much pain right now?
No,
Good.
good.
There was only a couple of minor lacerations on her buttock from the broken edges of the toilet.
Are you okay, Nancy?
Yes, thank you. Yes.
I felt, you know, a big, like, finally, a let go. You know, that this lady was out of any pain she might have been in, and there was a reprieve for her.
Nancy, we're going to need to do some additional tests just to make sure everything's okay. Sandra, we need a venous ultrasound of the lower extremities to rule out blood clot, chest x-ray, EKG.
Okay, sure thing.
I'd never seen anything like that before or after.
Doctor,
Yes, Nancy.
I have to go to the bathroom.
Okay.
Tess all in?
Yeah. Surprisingly, things look pretty good. She's really lucky.
Yeah. Do you think she's gonna forgive him?
You know, I seriously doubt it.
She was admitted for observation because we felt that she needed continued intravenous fluid to correct any dehydration.
Doctor, come in.
Thank you so much for rescuing my wife.
Oh, my pleasure. I'm glad we were able to help.
Can't believe I didn't die of embarrassment.
Oh, don't think twice about it. We see many unusual things in the emergency room.
Ever seen someone stuck in a toilet before?
Honestly, no. You're my first.
Hopefully your last.
Well, certainly it's a day in the ER I'll never forget. And since that time, I've been much better about not leaving the toilet seat up.
Stan's toxin results are in. He's using more than just fentanyl patches.
Stan's addicted to other medications.
I didn't realize how irrational he had become.
Why would he do that, knowing he could die?
If you don't take this thing out, I'll rip it out now! Now!
Dr. Valenti has no other choice but to address his patient's request to release him from the hospital.
Stan, take it easy. I just need a couple minutes to take out that line.
Doctor, do you have a moment? I have something to show you.
I just need 2 minutes.
It might be best if you see it now.
I'll be back in a minute.
Stan's toxin results are in. He's using more than just fentanyl patches. tested positive for opiates and benzos.
It's a wonder he's still alive. It turns out he was using not only narcotics, but also benzos, which explains why his pupils were dilated. He's obviously abusing multiple medications.
Stan's addicted to other medications?
I'm sorry, Susan.
Why would he do that, knowing he could die?
I think he's addicted, and he's lost sight of the risks.
I should have stopped him sooner.
And I'm sure he's tried to stop himself, but it's not easy. There's no chance of any recovery unless we would be able to get him to admit his addiction. But what I didn't realize was how irrational he had become.
I only left him for a minute.
Call security. If they see him, they need to restrain him. He could bleed to death. Unbeknownst to us, Stan's full list of medications include methadone and hydrocodone, and he kept some of them stashed in his locker.
Stan!
I'm going home.
We still need to talk, Stan. We did a tox screen. We know.
You need to get help.
Have they brainwashed you too?
The only one here brainwashed is you. You've convinced yourself you can handle this, and you can't.
I'm telling you there's nothing to handle!
Please, listen to yourself. Look at you. I won't stand here and watch you kill yourself. You can do that on your own.
I'm sorry. I'm sorry, baby. I don't want to. I don't want this to go. Sorry. I'm sorry. Please stay. Please stay.
Yeah, of course I will. I think we can survive this.
You found him. It's a relief.
So, through the hospital, we set up a rehab plan for him. He's admitted to the hospital and ultimately transferred to a rehab facility. And since that time, has been drug-free and narcotic-free.
I never would have guessed. He was getting seriously agitated.
It's still Stan. It was just the meds. That would put anyone on edge.
Sounds like it'd be a good episode for Trauma Life in the ER.
Good idea.
Joking, Gwen.
Come on. I'd watch it. What?
Nancy, my name's John. I'm the paramedic field chief.
Can you get out here?
How long have you been stuck?
Since 2 o'clock in the morning.
About 17 hours, Chief.
Nancy, we're gonna take care of you. We just have to figure this out. Give me a minute.
Yes, sir.
There's an initial
Pardon me, ma'am.
Oh no. Oh.
Okay. You take the left. Look at you. Ready? On three. 1, 2, 3.
can't take it anymore.
In college, my favorite show was Trauma Life in the ER, and that's what inspired me to become an ER doctor.
Dr. Valente, we have a nurse who collapsed upstairs. We're going to bring him down in a wheelchair.
Who is it?
Stan Williams, he was in the middle of teaching a class and he almost passed out.
Wow, really?
There's nothing open right now.
We'll put him in Trauma 1. At that time, we opened up one of our trauma rooms knowing that it was a staff member. Roger, we'll need some lifting help in Trauma 1. A pulmonary embolism or myasthenia gravis could be responsible for his symptoms.
You get family members there, and you don't know how they're going to react. You don't know if they're going to freak out, if they're going to be an impediment to administering the care to the patient, or if they're going to be someone who gives you helpful information. There was quite a contrast. She looked very professional. He looked like a woodsman.
Chest x-ray is clear.
How is he, Dr. Valente?
His blood pressure's dropping.
Can I speak with you outside? It's confidential.
Sure. Are you doing okay?
Yeah, I'm fine. I was just wondering, over the last few weeks, Stan has been sleepy and lightheaded, and when I brought it up with him, he just blames it on his insomnia.
That's strange. He's never mentioned anything to me. Do you know if he's on any other medications? I couldn't pinpoint it, and she wouldn't really give me any more information, but it was clear that something more concerning was probably going on.
I just called his wife, Susan. When she gets here, I think it's best that you speak with her.
Eileen, you know, if he's on other medications, I need to know about it. He's very sick.
It's really not my business.
You can tell me.
I think you should check him for narcotics.
Why do you say that?
Just check him.
Okay, right here, we're good. So we knew we couldn't separate the woman at the time from the toilet, so we felt that we needed to put her on the gurney as is in the toilet and take it to the hospital the way it was.
I'll see you at the hospital, Mom. You're gonna be just fine.
Good luck, Nancy.
Is it wrong I'm excited to see this?
It's okay. Mina?
Hi.
Hi, I'm Dr. Zoll.
How's my mom?
She's doing okay. She's been through a lot, so she's a bit groggy right now. Can you give me any information on her medical history? She's not able to give me much detail at this time.
Okay, maybe.
She indicated she isn't on any medications right now.
That's right, except insulin.
She's a diabetic?
Yes.
You any idea when she last had insulin?
She missed 2 before I got there, but I gave her an injection when I found her.
Okay, and the paramedics aware of that?
No, I forgot with all the commotion. She's had it all my life. I don't even think about it.
Okay, that's okay. Would you like to see her?
Yes, I'll just finish this text to my dad. He's been out of cell range.
Okay. That the patient.
Mom, how are you doing?
It's okay. I'm tired. My body hurts.
Can we talk somewhere else?
Follow me. Finally, it was very clear that something was on her mind.
You said the situation was serious. Then I'm gonna tell you the truth.
We cut off all his clothes, and at that point we also see in his left chest that he has some major abrasions, some bruising there that no one else had appreciated before.
Daniel, you have any pain in your abdomen?
No.
Okay.
He has no abdominal pain. His pelvis is stable. We check with that. His upper extremities are moving.
Okay.
My impression was maybe I will save the leg. It's probably not going to be a great leg.
Hang in there, sweetie, okay? I'll be waiting here.
We're gonna go grab a coffee. We'll be right back.
Okay. Tanya, why don't you have a seat in the waiting room? I'll let you know as soon as I find anything out.
I can't believe this is happening.
I know. Do you want to speak with the social worker?
No, I'll be fine. I just, 15 minutes ago, all I could think about was his leg, that he was going to lose it, and now I don't even care about his leg. Now I'm just worried that he's going to be paralyzed.
Just don't lose hope, okay? We're doing everything we can.
I know. Oh, no, thank you, okay?
So what we do is we call a pan scan, really, and it's basically a CT scan of the head to look for brain injury, cervical spine to look for spinal injury, chest with contrast to see if there's any injury to the major vessels, abdomen, pelvis, and we also get recons, we call them, or reconstituted studies of the thoracic and lumbar spine from those images.
When we rolled him on his side and he screamed, it wasn't just because of his spinal injury. He also had broken ribs and internal bleeding. Look at all that. He's got blood all on that side of the chest.
There's a pulmonary contusion there and the broken ribs.
When we step back and realize he had a T10 burst fracture pulmonary contusion, kind of if we were to really put his picture back together, we realized he probably got his leg and his pants caught in his stump grinder, and he was thrown around like a rag doll to the ground, fracturing multiple ribs, breaking his spine. Meanwhile, his leg is being ground up. He had multiple rib fractures on the left side of the chest where we saw that abrasion. Actually, the point where you'd call, I think he had 8 rib fractures in the left chest, what you would call a flail chest, because the chest wall is not at that point moving appropriately to cause comfortable breathing. He had a pulmonary contusion, which is major bruising with bleeding within the tissue of the lung. And that's a big deal because you're dependent on that lung tissue to exchange oxygen and carbon dioxide.
We got to speak with spine surgery now.
Yeah.
Okay.
Can maintenance get her out without hurting her?
That's what they're coming to find out. But we have to kind of bow to their expertise in terms of where it was safe to break a toilet.
He honestly thinks he's controlling his pain, but after years of abuse, he's not getting the same high. Now I suspect he's dealing with multiple medications, higher dosages, and deadly combinations.
Oh my God.
Now the important thing is that we can get him to admit to his addiction and get him help.
Rosie, let's get an EKG and a cardiac profile on this guy in room 7.
Dr. Randall Jotty knows that diagnosing a patient means looking beyond the obvious. A lesson that's driven home when the victim of a freak backyard accident is flown to his ER.
Got himself caught in a stump grinder.
Stump grinder?
Danny, what happened?
I've seen 60 or 70,000 patients in my career, and this one stands out for obvious reasons.
This is Daniel, age 35, left leg laceration, completely degloved. He's in a regular sinus rhythm.
A lot of emergency medicine, a lot of medicine is patterns. Let's give him a gram of Ancef and a tetanus shot. And you get caught up into the patterns where you see people, you know what to do. Occasionally it's someone who doesn't fit into that pattern. Daniel, can you feel this?
No. For this patient, a catastrophic leg injury may only be the tip of the iceberg.
And he starts screaming in pain just as we do the roll.
That should be an alarm bell that tells you something else is going wrong here. I got to be looking a little bit deeper, find out why this person doesn't fit the patterns.
He's got a burst fracture to the
Oh, he just
temporostic
crushed
vertebrae.
that. We have CT scans, MRIs, we have greater resources, we have greater diagnostic capacity.
He must have been thrown to the ground like a rag doll.
He's going to be in the ICU a long time. But we also have a larger expectation to get the answer, especially while they're in the emergency room, like with this patient. We got to speak with spine surgery now.
Quick action on Dr. Jotty's part has led to the timely diagnosis of a severe spinal injury and a life-threatening bruised lung.
Could have been a long time before someone identified his spinal cord injury or his pulmonary contusion, and could have been a very different outcome. And you think that could have been me or that could have been my family member, and you realize how much we all share together. And you identify with the patient and how close they came to something that could have been very, very tragic. Best of luck to you guys.
Thank you, doctor.
Thank you.
Bye.